Good evening, I'm Casey Nolan. Welcome to Stay Tuned. Obamacare, it's what just about all of us call it, perhaps for different reasons, but tonight we are talking about one very specific, one very key component of the Affordable Care Act, the expansion of Medicaid. It's part of the 9 Network's ongoing coverage of health issues, and for that reason we are digging deeper into this issue. We are talking about this not just from the health perspective, but also from an economic perspective, from a national perspective, and from a community and even personal perspective. Got a lot to talk about, so stay tuned.
Here's what we're dealing with. Right now, about 60% of Americans from age 19 to 64 get health insurance through their jobs. About 6% buy it out of pocket. 13% are covered by public plans, mostly Medicaid. But 21% have no health coverage, public or private, and that population is the target of the new law. Starting in 2014, the uninsured who make above 138% of the poverty level will have to buy coverage on the new health insurance exchanges going online this fall, or pay a tax penalty. The Supreme Court has upheld that part of the law. Lower-income adults would be covered by expanding Medicaid. Here's how this would be funded. For the first 3 years, the federal government would pay the full cost of Medicaid expansion. Then states would start paying. By 2020, states would foot 10% of the bill. Estimates vary, but Missouri could end up paying $100 million a year and get $1 billion in federal funds. Shortly after he was reelected, Democratic Governor Jay Nixon traveled the state to announce his support of Medicaid expansion. One of his stops was at the BJC campus in St. Louis.
I've come here today to announce that the budget I plan to submit to the legislature for fiscal year 2014 will include the federal funding to provide health care for an estimated 300,000 more Missourians, men, women, and children who currently have no health insurance. It is time for us to move forward.
I have to say at what cost. I have to say at what cost to the current system and at what cost to future taxpayers.
It was Jim Kircher from the 9 Network reporting. Okay, now we're going to a national perspective to get the conversation started. Joining us from Washington, D.C. via Google Hangout is Joy Wilson, Health Policy Director with the National Conference of State Legislature. Thank you so much for joining us tonight, Joy. We appreciate your time. So when the Supreme Court ruled on Obamacare, if you will, ACA, they said Medicaid expansion specifically could not be forced upon the states. The states have to decide on their own if they're going to expand this program. What are you seeing nationally? How is this shaking out around the country?
Well, states are taking their time and thinking about what approach they want to take.
And so is it too early to say if more states are leaning towards it or more states are shying away from this? Or what do you predict, or can you predict? Or will you predict anyway if you can't, for our benefit, please?
At the present time, there are about 8 states that are pretty definitively going to go forward. After that, I think it's we'll know in a couple of months when more states have, the legislatures have been in session and really started talking about the impact for the state.
This is not something that's predicted to pass, at least this year here in Missouri. How does Missouri compare to other states around the country? We have a Republican controlled legislature and a Democratic governor. How do we compare, perhaps even to the states that are immediately around us on our borders?
Well, Illinois, for instance, a Democratic governor, Democratic legislature, they're moving forward. Maryland has a Democratic governor and a Democratic legislature. They're moving forward. But then you have Arizona, a Republican governor, Republican legislature, and we don't know what they're going to do. The governor has put it in her budget.
Some indication there that oh, go ahead, I'm sorry.
So there's an indication that she's publicly supported the Medicaid expansion, as have the Republican governor in Nevada and a few others. So It's not strictly a partisan issue at this point. It's a economic issue, and each state has to look at how their state Medicaid program looks and how their budget looks and make a decision about what they think is best.
Okay, so what are some implications if a state doesn't expand?
Well, it does leave some gaps in coverage. The Affordable Care Act was carefully constructed to create a platform that was Medicaid, and then above that, the coverage through the exchange. And then for people with higher incomes, they could either go outside of the exchange, they could buy within the exchange, and many of them would be covered by employer-sponsored coverage. But the idea was to provide an affordable gateway for people who previously were not able to afford coverage, and that happens through the exchange because there are subsidies available on a sliding fee scale basis.
So is it possible to make too much money, if your state does not expand Medicaid, is it possible to make too much money to qualify for Medicaid and yet not enough money to qualify for an exchange?
I've lost your sound.
Let me try one more time. Is it?
Now I can hear.
Okay, good, great. That's, is it possible? Is what you're saying? Is it possible, if your state doesn't expand, that you would make too much money to qualify for Medicaid, but not enough to qualify for the exchange and be left in the middle? Is that what you're saying?
What I'm saying is actually, if you're the lowest income and you would have been in that expansion category, so people with incomes below 100% of poverty really don't have a place to go if the state does not do the expansion. Because if your income is below 100% of poverty, you're not eligible to participate in the exchange.
Besides the dry heat, Arizona and Nevada share the very hot topic of immigration. Is there anything at play there when it comes to whether a state might want to expand their Medicaid?
Yes, under the law, legal immigrants, these are people that have green cards, so these are people who are here legally, are able to participate in the exchange. And of course, under the law as drafted, there wouldn't have been that gap with low-income citizens not having a health home. But under the law as affected by the Supreme Court decision, we do have citizens that would not qualify for coverage.
So too early to tell, too early to call the race, if you will, on how many states might adopt this year. Also, we're looking at some gaps if states don't adopt in immigration. In the news this week, and also playing a role perhaps in the expansion of Medicaid. Joy Wilson, excuse me, thank you so much for joining us from Washington, D.C. in the National Conference of State Legislatures. We appreciate your time.
Thank you for having me.
Thank you very much. So coming up, we're talking more in depth specifically about Missouri with our team of journalists here in the studio. But first, we know you have questions, perspectives, and other things that are going to make this a smarter conversation tonight. Ed Reggie is here to tell you how you're a part of tonight's show. Ed?
Thanks, Casey. Well, you are a critical part of the conversation tonight, and we want to hear from you. What's at stake? And how has the Affordable Care Act impacted your family and your community? We want to hear from you, and we made it easy. There's two ways. You can log on to our Facebook page, The 9 Network. We put a graphic up there earlier today. We want to see your answers. You could actually answer us right there. We'll be using those throughout the show. Or you could actually send us a tweet using the hashtag StayTunedSTL. Again, what are your questions that you might have about Medicaid expansion in Missouri? We want to hear from you. Casey?
Okay, Ed. Okay, we are back in the studio now with our team of journalists who have been covering this issue. We heard Jim Kircher from the Night Network start us off. We appreciate you being here tonight, Jim. Joe Mannies with the St. Louis Beacon, also
Yes.
J. Rob or J. Bomb? I can't decide which I want to call you.
You know,
Jason Rosenbaum.
They call me Jason Rosenbaum, but you can call me J. Bomb, Casey.
Okay, thank you. Also from the St. Louis Beacon, providing tonight's humor too, if you don't mind carrying that load for us.
Apparently, the people in the back think I'm hilarious.
Well, they're not mics, so the audience can't hear their laughter.
Fair
so
enough.
learn to work with your environment. Okay, we appreciate all your time. Okay, let's start about this real quickly with Missouri. Let's dive right in. With politics plays a big role in this. We have, as we've discussed already, Republicans. The governor has said this is the right thing to do and the smart thing to do, but Republicans have said they're not going to do it. Is there any chance this will pass and we will expand Medicaid in Missouri?
Well, I think there's two ways that it might. One, I think, is if some rural hospitals actually begin closing, or talk seriously about it. Most of the rural legislators in Missouri are Republicans. And in many of these rural towns, as Jim has had in his excellent show earlier this week, that these small hospitals are a key piece of those towns. So if that starts happening, there may be some discussion, at least within Republican ranks, and you may see the type of rural-urban split that you see on other issues, because most of the Republican leaders in the legislature are actually from the suburbs. And so they're seeing this a bit differently and are taking it more of an ideological position that government shouldn't be so involved in the healthcare.
And we're going to talk a little bit more, just so folks are clear, about why rural hospitals will be impacted.
It's interesting, and Joe and Jason, I'm not sure if you guys agree with this, but if you take Obamacare, or just Obama, and put them off to the side, healthcare is not a Republican or Democrat, liberal or conservative, urban-rural split issue. Healthcare is an issue everywhere. And I think what's going to come out of this debate, not necessarily right now, not necessarily in this legislative session, is this debate is going to go beyond those traditional splits. I mean, they're going to have to find some, I think they will find some common ground. I'm not exactly sure where it is.
We've talked a lot about whether they're going to expand Medicaid or not. I think the chances are not particularly high, but not impossible, as Joe said. But I always like to point out the consequences if that happened, and I mentioned it briefly on Jim's show, and I think you mentioned it in your Google Hangout, is that if they don't pass the Medicaid expansion, these are going to be people who are going to make too much money to be on Medicaid, but they're not going to have enough money to purchase insurance on the exchanges.
We're talking several 100,000 people in Missouri.
And that's going to be, there's already that consequence now before Obamacare ACA.
And I think an interesting part of that is that the people who are affected by this, a lot of the people, are not people who have a lobbying group. They're not organized. They don't have advocates for them, I think. And I think that's why it's going to take a little time. I think if you look at Medicaid now, you've got children who are pretty well covered, pregnant women, the disabled, all groups, I think, that do have advocates. The folks that are in that 300,000 or 250,000, there are lots of different people.
They're working. They're the people who work in the restaurants, the waitress.
Working two jobs.
Yeah, working two jobs, but none of them provide health care. And so that's what you've got. I mean, the truck driver who's driving his own rig, who doesn't have health care. And now the basic Republican view is that the free market is the best way to tackle that. And I'm not taking sides on that, but that's what their position is. Right. Now, one of the things that Nixon, though, did do at the State of the State address on Monday, when he laid out his push for it, was that he had a bunch of business people, including major business leaders in the state, who are not fans of Obama and who were definitely Republicans, but he had them stand up saying that they were supporting Obamacare because this is the law, and they see that this is, in the long view, the economical thing to do. Now, many of these are also Republican donors, so there's a potential that could have an impact.
But here's the thing, and we've said this zillions of times at this point. The opposition to expanding Medicaid, a lot of it is philosophical, and a lot of the senators who are not going to be swayed by those interest groups, or the Missouri Hospital Association, are going to oppose this no matter what pressure there is, and no matter what group threatens to withhold donations or threatens to make threats or anything like that. So even if you get 18 votes in the Senate, which I guess is the amount you need to pass a bill, you're going to have to get those people who are adamantly opposed to sit down from filibustering. And it may not happen this year, It may be a couple-year process for that to happen, but from a legislative, practical perspective, that's the challenge, even if you get people to switch sides.
Do we have to get to, oh, go ahead.
No, I was going to say, I think the question here is, can there be some progressive movement? In other words, so we'll have the Republicans come out with their innovative solutions to helping and improving Medicaid. They're going to maybe ask the federal government for waivers. Maybe they'll get it, maybe they won't.
Right.
But I think this is what's going to happen, where that common ground, we want to be innovative, but I think those innovations are going to come closer to what the Affordable Care Act is trying to do. If it goes in that direction, I think that's where it's going to go.
And you'd need about a quarter of the Republicans in the House to side, because there are so many Republicans, they have a veto-proof majority, about 109 right now, out of 163, and you only have, less than 60 Democrats, so you'd need a large chunk of the Republicans to willing to go for this to get it passed.
Does this math have to work out this year? Why? Jason said it might take more than a session. Is there a downside?
Well, the downside to delaying is that it's 3 years that the government pays. The clock starts in 2014. So if the state, let's say, waits and doesn't join until 2015, then they only get 2 years of
there's no
government
red
payment.
shirt year in this.
There's no,
right?
No,
like, when you
nothing
come
like
on,
that.
then you start the 3 years. So the longer they wait, unless the federal government changes the rules, they lose out. Every month that they wait, they lose some of the free money.
And the other loss that's being talked about, of course, is the DISH payments, the money that goes to hospitals to help for uncompensated care.
What else? Okay, besides Medicaid expansion, what else give us the state of health care in Missouri?
Oh gosh. It's funny because
in 90 seconds.
Here's the agreement. Nobody thinks it's good enough, and even the Medicaid system. Proponents, opponents to Obamacare say it's a broken system. And it really comes down to the people saying, well, we need to fix the system, then we can talk about these other things. And the folks who are in favor of the Affordable Care Act is like, no, if we get everybody insured, that's the beginning of how we begin to fix the
Another
system.
challenge besides coverage is medical professionals, especially in the rural areas. There's always going to be a demand for them. There's going to be a bigger demand once the ACA gets in and more people are empowered with insurance. That's a whole nother conversation.
If everybody says the access to primary care is inadequate and you add another 250,000 people into that system, what's going to happen? Nobody has a really good answer for that except to say, well, it's already a problem and we're working on it, and the solutions will have to be forthcoming.
Well, as Jim mentioned, without the Medicaid expansion, hospitals now get a big chunk of federal money going through the state that pays for the people who show up in the emergency room that don't have any insurance. It helps, at least covers a little bit. Well, that's supposed to go away. So whether Missouri
that money is supposed to be
takes
shifted to the expansion.
Yeah, so whether Missouri takes the expansion or not, so the hospitals stand to lose. So if they don't get the extra money they're supposed to get from the Medicaid expansion, they're going to lose this other money that they get now. So that's why there's a sense of urgency among members of the hospital association, especially in these rural hospitals.
Yeah, and the giant hospitals like BJC, they'll figure out a way to adjust to that. They have said that. It's the smaller hospitals, and I think that's what, as you've said, if there's a pushback to the rural legislators, it will be from those issues.
Okay, guys, thank you very much. We appreciate it. Coming up in just a minute, we're going to talk about the economic impact of this expansion on our economy. Is it good, better, worse, without it, with it? But first, jumping off of what Joe and everyone here was just talking about, doctors are on the front lines and they see these issues firsthand. We have a report from the 9 Network's Anne-Marie Berger.
Hi, Ms. Moore. Do you need refills on any of your medicines? Hello there.
A morning packed with patients is typical for Dr. Heidi Miller, a primary care physician at Family Care Health Centers in St. Louis.
Some people think that in primary care that you just serve as a referral gateway, or you just take care of the sniffles. And today on my schedule, I've got 25 patients. Most of them I see often because they are so sick, and there is not one easy, straightforward, healthy patient with a runny nose. You pass out, how are you feeling immediately beforehand?
Miller's practice is a federally qualified health center, and they take care of patients regardless of their ability to pay.
Our doors are open to everyone. We take care of Medicaid patients, patients who don't have any insurance. We do some Medicare, a little bit of private, but we serve everyone. How much weight do you think you've lost from the beginning?
Over 50 pounds.
It's amazing.
Dr. Miller is passionate about her work and the need for access to primary care for all people. She says it's the key to prevent and stabilize life-altering illnesses.
Patients with diabetes and high cholesterol and hypertension are at an extremely high risk for heart attack or stroke. So we are preventing or postponing that as long as we possibly can. Without this preventative care, without this primary care, this kind of patient can get extremely sick. It can impair their current ability to work, and they can get so sick that they get some infection that they never would have gotten if they were on their insulin. They end up in the emergency room for $1,000 or $2,000, and it was all preventable. I'm going to check your blood pressure.
So we know that when someone is uninsured, that they don't go for primary care. They delay care, they don't seek care. Even when they're sick, they wait until they're really sick, and then they go to the hospital. So we know that the uninsured often get diagnosed with cancer, later stage cancers, which means that it's going to be more expensive to treat, and they often don't have as good of health outcomes. And so we see higher death rates among those without health insurance.
Every study that's been done shows us that people value health insurance, they want health insurance. The problem is they can't find affordable insurance that's quality insurance. That's our major policy challenge here.
Okay, welcome back into the studio. That was Anne-Marie Berger from the 9 Network reporting for us there. She was definitely starting to touch on what we're going to talk about here, Amy Bluen from the Missouri Budget, Missouri Budget Project. I second-guessed myself for the last second there. A nonpartisan organization that analyzes policy here in our state. She kind of started to touch on some of the dollars and cents of this a little bit there, the benefits of primary care. Is this, you've looked at this expansion as a policy. Is this something you can talk about in dollars and cents for our economy? Does it kind of pencil out in some way?
Absolutely, yeah. There is a significant fiscal impact, a help to our state's budget, and an economic impact for employers, for individuals, for our communities, for hospitals, and the healthcare industry.
How so? How? Because we've heard, I mentioned it earlier, the governor said it's not only kind of the moral thing, but it's the economically smart thing to do. Why? Why is that?
Well, let me give you one example.
Okay.
You know, the Hospital Association did an analysis of the impact on the hospital industries and ancillary industries and communities where they would potentially receive the funding to care for people, you know, under the Medicaid expansion. And their analysis indicated that we would create 24,000 jobs in the state just as a result of the federal funding. That's huge. You know, if you look at that compared to what our unemployment rate, it's a significant impact for us in terms of jobs that are related directly to the Medicaid expansion. That makes sense. That makes sense for our communities. It makes sense for our hospitals and for all of us when we're looking for care, to know that those care industries are enhanced by the Medicaid funding.
Does it make, is it different for different parts of the state? Joe was touching on just a minute ago the rural hospital.
Yeah, and I'm glad they brought that up. Definitely the rural impact is going to be much more significant than in urban areas. Urban areas where hospitals can somewhat absorb caring for the uninsured, and rural hospitals don't have that luxury. So if the rural hospitals and their financing is compromised as a result of not expanding Medicaid, we could see rural hospitals closing, we could see a lack of providers and healthcare resources for everybody. It's not just about the Medicaid population, it's about all of us.
So that's where you might see some jobs lost, unfortunately. But back up for just a second there, you know, when the hospitals come out with a study that says this will create jobs, people might have a tendency to roll their eyes and say, well, of course they're going to say that. Do you really, truly believe this will create jobs?
Yes, we absolutely believe it. I mean, and first of all, let me back up. The hospital report was an analysis that was done by economists at the University of Missouri. And they did a really good job of looking at a modest scenario for what jobs would be created. So it's rather, if you will, it's a conservative estimate. It could be even greater than that.
Okay.
We use those economic models for all sorts of things. things, you know, in the state. We look at transportation and what investing in infrastructure and construction, what that would create in terms of stimulus. It's the same kind of thing. You know, if we've got an influx of federal dollars to the state, it's significant. It has a good impact. And it also helps us with our state budget, you know, and that's going to have a particular benefit for us right now as we're still struggling with the state's budget.
Is there a population that is just simply not in the marketplace, so to speak, right now that would create more demand, thus create more jobs?
Absolutely. You know, we right now have more than 800,000 people in the state who are uninsured. By pulling those folks into the covered, if you will, those with insurance, it will help us not only in the healthcare industry, but also, you know, folks who are currently working in small businesses, which is one of the largest growth areas in the state in terms of jobs and the economy. Those folks could have the benefit of being able to be entrepreneurial, if you will, you know, that they'll be able to take some risks, to look at different opportunities and know that they will be, there will be a cushion for them.
Of course, when you say the influx of federal dollars, I know there are those who will say those are federal dollars aren't free dollars, those are our dollars that go to the feds first. What do you say to those folks?
So a lot of things. You know, we do contribute to that pool of funding from the federal government, so we should, you know, use this as an opportunity to leverage some of that in return. We also know that because the Affordable Care Act was fully federally funded when it was passed, meaning that they offset costs within the bill with decreases that existed previously. That means that it's money that does not add to any deficit. It will create a boom to the states, and it just makes sense for us to do it.
Are there savings that we could have if we do expand too? We're talking about creation of jobs and different influx of money. What about any savings?
Absolutely. The state's budget has a number of categories where we currently spend money that we will not need to spend any longer if the Medicaid expansion occurs. So one example is we cover pregnant women while they're pregnant in Missouri up to a certain level of poverty. There's a chunk of folks who would now be eligible for Medicaid who are currently covered under that program. So there will be cost savings there. There will be cost savings in mental health, cost savings in corrections, and hospital care for those who are incarcerated in the state. So all of that together means we will actually reduce our current costs in state general revenue by about $50 million within the first year. You know, even when we get to the point where the state is contributing 10% of the cost of the Medicaid expansion, we will still save money.
Amy Bluen, thank you very much. So not only savings, but job creation, you're confident, coming from the Missouri Budget Project's perspective, and especially beneficial to those rural communities that we talked about.
Absolutely.
Okay, next let's go back online to see what you're saying, what's resonating with you in tonight's conversation. Okay, we're back in the studio. We're going back out of the studio at the same time, though, with Google Hangout again, I believe. Here we're going next to the other side of the river. Joining us, a repeat guest on the show, Amanda Vinicky from the WUIS Public Radio State Bureau Chief in Illinois. Thanks, Amanda, for being back with us. Little different situation maybe in Missouri if you've been following along, and I know you know a little of what's going on in Missouri by the nature of your work. So how are things different on your side of the river when it comes to Medicaid expansion?
Well, in many ways, there are a lot of similarities in that you still have a debate over the cost of Medicaid expansion. Is this the right thing to do? I think the difference, of course, being that in Illinois, we really have Democrats who are running the show.
Right.
And so whereas there remains opposition by Republicans to Medicaid expansion for many of the same reasons, primarily, how is Illinois going to cover these costs? Yes, Illinois is projected to get $9 billion from the federal government if it goes forward with this Medicaid expansion. Nonetheless, the state will eventually have to pay for the for 10% of that cost and come 2020. And how is Illinois going to afford that? As we've previously talked about, many a budget issue here in this state, so it's not as if there are those dollars. And not only that, but also the administrative costs. So that remains an issue, but it does appear as if Democrats want it to go through, and being President Barack Obama's home state, one would imagine that that is the case, that they would be able to do so despite that GOP opposition.
Okay, so let's expand on that a little bit. If Missouri is concerned that Missouri can't pay for it, and here in the St. Louis region, all we hear about Illinois state government is it can't pay its bills, how can that work?
Well, what you're hearing from Governor Pat Quinn's administration and from the Department of Healthcare and Family Services and from Democrats that want to do this is that they're already paying for that. As I just heard your previous guest describe, there are plenty of state programs that cover many of these needs, that cover these programs. You might have an individual who right now lacks any insurance that goes to a hospital and ends up in the ER for something that could have been prevented were they to go to a family care practitioner in the first place before things got so bad, or to a community health center. So it's that same mentality. Also, how do you forego all of that money? It's 100% funded. And so there does remain that skepticism that the federal government's actually going to follow through with this. Illinois is putting in the proposed legislation a guarantee that if federal funding ever gets below that 90% that is currently promised, that Illinois would rescind this Medicaid expansion completely. And
can they do
again,
that?
Just to point out who we're talking here, it is individuals who are childless adults that right now aren't really covered by any program, and those who are low income enough that they wouldn't be covered by the subsidy that would allow them to purchase insurance from the exchange.
That's who will benefit from this in Illinois. And just to back up for a second, can they write that into the law? And is that something that will pass even with the Democrats in control in Illinois?
Yes, that's kind of Democrats' concession to both Illinois' budget woes and to Republicans. What the fear of Republicans is, not only does Illinois have the money, not only we don't believe necessarily that the feds will follow through, fine, there is this clause. Even if that comes to bear, they say, wow, we just passed, actually in the spring, a moratorium on any Medicaid expansion. We've looked at how quickly Illinois is to turn its back on that as soon as it gets this, offer from the federal government. So what's to say that that wouldn't happen again? They say it's unethical. It's wrong to hold out this program to these people who need it, to millions of individuals that right now lack any sort of health care coverage, and then to take it away so soon thereafter. So they just don't believe that Illinois would do that. And if it were to, that would be unconscionable.
We're at the federal minimum here in Missouri for Medicaid eligibility. Different story in Illinois, right?
Yes, and Illinois has actually gone back, as I was alluding to right there in the moratorium. Illinois has made some changes to its Medicaid program in past last year. It really did take absolutely months, and it was a bipartisan effort to cut back on some of that coverage because Illinois was really out there. So Illinois cut back in terms of, for instance, the drugs that it covers. Illinois now has a cap, for instance, on the number of prescription glasses that somebody could get, whereas before there was no limit. You could buy a new pair of glasses theoretically every day. I presume somebody would have maybe said no eventually, but it could have been done. So
someone would have seen right through that.
Checking its roles, but it is definitely a state where, particularly under former Governor Rod Blagojevich, Illinois expanded health care coverage. That was his signature.
Okay, can we talk future and maybe a little bigger picture here for a second? What else is going on in health care besides Medicaid expansion in Illinois that you think we'll be hearing about, or what do you see the future of the Illinois health care system?
I think we're going to be hearing a lot about in terms of the Affordable Care Act as all states go through it. Right now, Illinois is starting out the first year with a partnership in terms of this, what's known as the insurance exchange, that will allow individuals that work for small businesses or these low-income individuals that get a subsidy to be able to buy off of this kind of Orbitz-like platform where they can look at different insurance plans. Illinois is starting its first year with a combined exchange, so partially state, partially federal. But in future years, there's definitely a desire to have just a state-based exchange so Illinois can make a lot of decisions on its own. You're having a lot of differences of opinion between healthcare advocates, so kind of those do-gooder groups, and the insurance industry, which is really powerful in Illinois. Illinois regulates insurance different than many other states, and you'll note that Blue Cross Blue Shield, Allstate, State Farm are all headquartered here, and that's a reason. They're generally a industry that is looked upon favorably by the General Assembly, and they're heavy hitters from a lobbying standpoint. So look for that to be a major issue. And actually, next week, Governor Pat Quinn will be giving his State of the State address, and I'd hypothesize that's something that he'll hit on. Again, Obama's home state, he wants to make this an issue.
Amanda, thank you. So it will likely pass, but still some skepticism on the other side of the river of the federal government, and some concessions being made because of that. Amanda Vinicky, thank you so much for joining us. We appreciate your time. And this is an issue that goes obviously beyond the St. Louis region. We sent Jim Kircher into rural Missouri. Jim reports on how this will impact rural Missouri from Dent County.
The story took us to Salem, Missouri in Dent County. You head out I-44 to Rolla and then head south. It's a town of about 5,000. It has a great old 1870 courthouse, a historic downtown, a more modern business strip, and it also has people without health insurance. Dr. Vicki Gully sees those patients in Salem and in the free clinic she runs in Newburgh, Missouri.
Certainly the rural areas have maybe even more reason to have less coverage. Small companies that can't provide health coverage, and there's no insurance available. Walmart in a rural area becomes a big employer, and they tend to do a lot of part-time, so they don't provide health coverage. People that have their own businesses, they're out there cutting wood, or they're out there, small farmers. They cannot afford, there is no way to afford their premiums monthly buying some health insurance off the internet. It's not possible. They just risk it.
The numbers vary throughout the state, but the highest percentages of uninsured, 20 to 25%, are in rural counties. In St. Charles County, only 9% of the population doesn't have any kind of health coverage, 12% in St. Louis County. In St. Louis City, it's around 19% uninsured, and that's about the same as Dent County. Of course, here, the actual numbers are a lot smaller, but the problems are not.
Everyone needs health care. Everyone does. You know, the young ladies, they need their female checks. Men, young men still need monitored for the things that run in their families. An ounce of prevention is worth a pound of cure, so if you can catch things early, absolutely. But really the group that I see that gets into trouble is the older group that's gotten used to denying the fact they have any health issues. So that becomes part of what I see when I'm volunteering. There's a part of me that thinks if we want socialized medicine, well, then why don't we look at those kind of models? But we haven't opted to do that, so we're looking at this mix of having people cover their own health insurance plans, and I don't know if they're going to be able to afford it.
Okay, we're back in the studio and back at the table with some real people. Is it okay? Do you mind representing real people here?
Call me real people.
Real people. Okay, good. Not experts per se, but just some folks that we've got here to give us some perspective. All of you, I feel like, have a vested interest in this topic. I'll introduce you, and that may help people understand why. Chris LeBeau, working on a startup right now, kind of an entrepreneur. You also do a little blogging, talking healthcare on different issues around that subject.
You got it.
Nick Semenkovich, med student. You work at a clinic currently, correct?
I do.
And Sarah Thompson, thanks for coming back on the show. You're a freelancer yourself and a mom.
Yeah.
And I'm going to go ahead and label you all young. Is everyone comfortable with that?
Oh, yeah.
So young, freelancing entrepreneur, people yourselves or people you know, how important or how much of a factor is health insurance in your lives? I guess what I mean by that is the decisions you make about jobs or chances or other things. I don't know, healthcare, a big topic on your mind?
I mean, for me, just because of the line of work, that I'm in, and I even look around the studio and I think of other photographers, people I know in work in television and in the creative class, if you will, and health insurance is a huge issue because so many people, I don't know about you guys, but I mean, if you're not full-time employed somewhere, that you don't have health insurance, and so you have to seek it on your own. When you're a woman, that makes it, I've been through this myself because I left the firm I was with, started my own business, and I was buying my own health insurance for a good period of time, and it's absolutely scary. Breast exams aren't covered, maternity care isn't covered, and it's terrifying. And I know that people who work in this kind of field, this is make or break why they decide to have certain careers that maintain the careers that they have or move into something different.
More expensive for women.
Yeah,
absolutely. Oh yeah, absolutely.
Yeah, having worked in healthcare a little bit, Casey, I mean, it really is important. And one of the things I was kind of shocked to see a couple of weeks ago was that there's a projection right now that health premiums by, 2 decades from now, they estimate that they could be as high as your average salary for the year. And so it's something where we're already seeing costs like this where, I mean, it's hard for an individual to afford, let alone a family. And so it's a huge decision for anybody.
Yeah, I think from my experiences in healthcare, I'm a medical student and I happen to volunteer at a clinic on the weekends, and it's one of those places where you see really the impact of not paying for care that's cheap now, that's going to be really expensive in the future. I think one thing that people talk about when we talk about Medicaid is what's fiscally responsible. And I think what's important for people to realize is that, we can pay a couple of cents now for drugs that will prevent complications down the road that maybe not in 10 or 15, but 20 years down the road, there's serious implications that may cost hundreds of thousands of dollars. I think if you think Missouri is going to be around for 10 or 20 years, which I hope it would be, you plan for that long-term cost.
Right. I mean, I just, it's frustrating. It's really frustrating when I drive in the city and I drive past Barnes Hospital, and I've been in the emergency room both at Children's and at Barnes, and you're seeing a population of people where the ER is their primary source of care, their primary care. And I just think there's something fundamentally wrong if we are comfortable as a society knowing that people will continue to live their lives like this and we're not trying to do anything about it. And I think to your point, it's like from a financial side, it's an investment up front as I see it personally, and the long-term, seeing the long-term
not just morally are we okay with it.
And then there's morally, there's a huge human side to, and this is an American ideal that if we do better as a society, as a whole, healthier, smarter, we will do better as a country. We will do better as a community, as a region. I mean, you just can't get past it. I don't know why people are so hung up on this tit for tat. It's a reflection of who you are, your self-control. You're poor because you made it that way, and you don't deserve health care. There's no heart in that.
I think there are a lot of misconceptions. I agree about those people that lack insurance. A lot of times people say that they're lazy or that they aren't trying to get insurance. A lot of the people that I see in this clinic that I sort of volunteer at on the weekends, these are patients who they've been working all their lives. They just happen to be in small businesses that can't afford to provide them insurance. They sort of switch jobs a lot, and they sort of lose health care. And that's really a challenge for them to provide sort of continuity of care.
And when it comes down to that in the end, I mean, having to make decisions about, being in a lower income bracket, it comes down to making decisions between paying bills or utilities versus food in healthcare. I mean, these are the kind of decisions that people in these lower brackets have to make that are problems that many of us can't even begin to imagine, even as expensive as healthcare is in this country to begin with.
And it's an absolute disaster. It causes a lot of personal bankruptcies. I saw a guy a couple of weeks ago, we'll call him John Smith, who came in and he'd had basically untreated diabetes for all of his life. And he hadn't been cared for, not because he wasn't trying to get care, because he bounced around between different jobs and couldn't find a physician. And as a result of that, he ended up having a lot of very expensive complications. He had small heart attacks and had personally bankrupted his family. Him and his wife were in the process of losing their home. It was just a disaster. faster. And that's something that if we plan for now, we could spend a couple of dollars and save hundreds of thousands of dollars in the long term.
Okay, so what do we do? And you said when you drive past barns and you see these things.
Or when I've been in, I mean,
Well, I was going with the car analogy is where I was going with that.
Okay.
I mean, when your car insurance is not tied to your employment, you don't. Should healthcare be tied to a job? And what role should the government have in our healthcare?
I think it's one of the potential benefits of the exchanges in the long run is that many people will dread that chance of a job shift where is my next insurance plan going to cover something that's already been covered by my current employer. And if people are able to, in the long run, to reach outside of their employer and to go through an exchange to have that continuity of care, certainly enables you to make sure that you're continuing to have your diabetes treated, obesity treated, and all these chronic diseases that are proving to be such a massive problem in this country.
And I was just going to say too, kind of to jump back, was I would like for people when we talk about this topic to like set aside sometimes the stereotypes of who they think is actually sort of on Medicaid. I can tell you right now, people I know who are like PhD students who literally did coursework overseas so they could benefit from getting health care, going in the UK than doing it here because they couldn't because that was.
There are a lot of hardworking people. People have manufacturing jobs who just sort of bump around a lot, and they just are on Medicaid because that's just the only thing available to them.
Yeah, and I think that's the frustration because when you hear this like bigger dialogue about it, you know that people are instantly thinking rural or they're thinking urban, poor, and the welfare queen and all these sort of stereotypes. And it's just, we've got to get past this again. It's like this broader issue of what makes us better individually and healthier individually is better for the community and better for us as a whole.
And I'd say, I mean, the other thing, Casey, you asked the question about, what role should government play? I mean, right now, our healthcare system is built around when you walk through the door, that's when they make money. And that's the role that government needs to do in the long run, is really change how medical providers are paid for service, to actually pay to keep people healthy, rather than when you get readmitted to the hospital, even though it's a bad thing, the hospital makes money at that point.
That's their incentive.
And there's an incentive there. And not that they want it to be that way, but they are also in it to an extent to make sure they keep their doors open. And so, so their incentives and motivations are misaligned.
I had hoped we would solve this issue tonight, but unfortunately, tomorrow. Okay, we just 5 more minutes and we could have figured it all out. Thank you all for being here. I appreciate it. And I have a feeling some of what we have said is resonating online. So let's go back and see if it is and what folks are saying online. Okay, we're back in the studio with Margaret Donnelly, a SLU law professor, former director of the Missouri Department of Health and Senior Services. So I feel like you're extremely qualified to help us with what we have started here. Help us put this back together, if you will. We've gone in a lot of different directions. A couple of thoughts I have in my head about what we've been talking about, but first I want to hear what's resonating with you about tonight's conversation.
Well, I think, first of all, it's just so complex and multifaceted. Overarching it is this tension between what is the role of government in helping people get access to coverage. It's in the view of someone with the public health lens and prevention, it's about whether we will see that having access to health coverage is really the way in which we help prevent disease and keep people well.
We hear
it's
about
economic.
That. We hear about that. Let's talk about that for just a second. We hear about that a lot. Can you see a day when we are a healthier country because we've actually taken preventative steps seriously, when we're not struggling with weight, not struggling with diabetes, not struggling with heart disease, because we've actually we don't do anything on the front end almost. We operate on crisis mode as a society so much. Do you see a day when that can actually happen?
I see a day when we see that there's both the primary prevention, which is seeing that health is in all aspects of our life, and that means changing the way in which we design our communities, changing the way in which we eat, all of those sort of personal behaviors that are influenced by how we structure it. But then we also know that throughout the Affordable Care Act, there are many provisions for having prevention of disease by allowing people to get colonoscopies, to get mammograms, to have well-woman coverage at no cost to them. And so when the insurers, the private insurers, are forced to make sure that prevention is key in their delivery system, that is another secondary step in that whole prevention continuum. And if we integrate both that primary and that secondary prevention, yes, I see a day when we can be a much healthier world and state, and actually St. Louis region particularly. I think that what is missing for people right now is that access to consistent primary care. And we know that relationship is critical in helping people really have prevention in their lives.
Chris just talked about the incentive a hospital has. How do we change that incentive to do what you're talking about? Can that be done? Do they have to be incentivized, or does it have to be legislated?
I think the hospitals, the whole healthcare delivery system is going through this transformation. Again, the Affordable Care Act has specific provisions for accountable care organizations, for really changing the way we deliver it. But if you look at the community outreach and the work that so many hospitals in the St. Louis region are doing, and actually throughout the state, I think that everyone understands that it is more cost effective, and it is certainly better from a human standpoint to be sure that we're doing prevention.
And that kind of goes back to what you started to say just a minute ago, which is the economics of this. How do you see that playing out in a state that does or does not expand Medicaid? We'll talk about tonight's topic. If we don't expand Medicaid, what are the economic consequences?
Well, I think that we've already heard that there's two sides to this coin. There can be some incredible economic benefits. The study that cited that just in the first year alone, possibly 24,000 new jobs from doing this expansion. But there's also the very dark negative part, which is that we may have hospitals closing in rural communities, even in St. Louis, where I think someone talked about the fact that the larger hospitals will adapt. The study that was done by the Missouri Hospital Association gathering data, they're predicting that we could lose up to 3,000 jobs in the St. Louis region alone just by not doing this expansion over the next several years. And so this is really part of whether we continue to provide good support for our healthcare delivery system. And I think finally from tonight, we just have learned it really is a human story. Your last group of individuals really talked about people they know who go all the way to England just so they can get health care coverage consistently, the person who's working every day but just can't get insurance. If we don't do this Medicaid expansion, if we don't cover more individuals, we know that next January, the person will be facing the same grim health care situation as they do today. They can't get their flu vaccine and may lose lots of time from work. They don't get their blood pressure checked regularly. And finally, they just don't have somebody there regularly who cares about their health and can help them.
If you look at this strictly politically and kind of without maybe, or predictably politically, it looks like there's no way we'll expand Medicaid in the first year of the opportunity to do so. But then we heard from Jim and Joe and Jason talking about how, and you just mentioned again, the impact in the rural part of the state. Do you see different lines being drawn in versus other issues we might see, Republican versus Democrat? Could there be different battlefronts, if you will, that emerge from this that could actually get this passed or get this close to some sort of reality?
Well, because it is so complex and because the whole legislative process has lots of moving parts, I'm being optimistic. And I think that that threat frankly, of what could happen in the rural areas and just to our overall healthcare infrastructure without doing this additional coverage, I think may be enough to start changing some minds. But I think taking a long view is, even if it's not done this year, I think most states, including Missouri, will find themselves seeing that this really is the smart thing to do, and it is the right thing to do, because if you look at the whole history of Medicaid since it started in 1965, it has been these incremental expansions, and I think that this is a new area. It does include people that we haven't often thought would be on Medicaid, but it is a fundamental belief of people in this country that everybody should have access to health care. And so I think that ultimately Missouri will join with other states and we will see these people covered.
We have just a few seconds for me to play devil's advocate. But we can't trust that that money will really be there, and the smart thing to do is to look out for our own state finances, is what some of the opponents will say. Do you buy that argument?
I think that because of the way the Supreme Court laid this out, with it being a voluntary program, that what Governor Nixon has proposed, which is similar to what Illinois says, is we will keep our commitment and cover these people if you keep your commitment in terms of the funding in the federal government. If not, we will be able to adapt to that.
Thank you very much. I appreciate your time. Margaret Donnelly from SLU, thank you very much. Let's go back to Ed quickly for more of what's being said on social media.
Thanks, Casey. Well, we've heard a lot tonight, and we want to encourage you to go back to our Facebook page. There's a lot of links, a lot of resources. We also would like you to go to our 9net.org/health. There's tremendous resources there that we want to direct you to. And also, we want you to participate in the after show. We have a live stream. You could visit that at staytuned.9net.org/live. That is our after show. We want you to join in and stick around. It's where a lot of conversation continues, and we still want you to continue the conversation. Casey?
That's right, Ed. I've been offline for several minutes now. I'm jonesing for some Twitter. We will be here. If you're watching online, just stay online with us. If you're not, find us online and stay tuned. Whatever you do, we appreciate it. What are the issues that are important to you and to the St. Louis region? Share your insights. We want your ideas for a future episode of Stay Tuned. Call 314-512-9009 or email us at staytuned@ketc.org. Would you like to be a live audience member on Stay Tuned? Email us at audience@ketc.org. And you can always connect with Stay Tuned on Facebook and Twitter.